Good morning, everyone, and happy Valentine's Day. My name is Dr. Anjana Pillai, and I'm a transplant hepatologist at the University of Chicago. Today, we're going to discuss how to stay healthy while battling chronic illness, specifically chronic liver disease. Before we start, I would like to thank the American Liver Foundation for giving me the opportunity to speak with all of you today. Okay, let's get started. So these are our three objectives. First, in order to understand how to stay healthy, it's important to understand what our liver does. Second, we need to know what signs or symptoms we can experience when our liver becomes damaged or scarred over time. And finally, and most importantly, we'll focus on ways to stay healthy despite having chronic liver disease. So what does the liver do? Whether you know this or not, your liver is your largest internal organ, and it has more functions than any other organ in your body. Remarkably, it can sustain life even when only 10 to 20% of liver tissue is functioning. And a normal liver weighs 12 to 1,500 grams and is located on the right upper side of your abdomen. So let's specifically go through what our liver does for us. First, it metabolizes or breaks down nutrients from food to produce energy. It also stores vitamins, minerals, and sugar, and it also helps regulate your body's blood sugar. It removes potentially toxic and foreign substances from your body, including the byproducts of medications, removes chemicals and alcohol and drugs. Importantly, it helps your body fight infections by removing bacteria from the blood. It produces many of the proteins needed by your body, including proteins involved in blood clotting and nutrition, which is why when your liver is not working, many people have issues with bleeding or frailty or lack of muscle mass. It produces bile, which helps digest fat and absorb certain essential vitamins. So as you can see, the liver is a very multifunctional organ. It's pretty amazing. So what happens when you have chronic liver disease? When healthy liver tissue is replaced by scar tissue, the liver slowly loses its ability to function. This often takes years, and there can be any number of reasons why this occurs. The most common causes of liver disease include infection with certain viruses that affect the liver. Most commonly are hepatitis B and C. It can be due to the harmful effects of alcohol or drugs. It can be due to abnormalities in your body's immune system, often referred to as autoimmune diseases. It can be due to fatty liver disease or other genetic or inherited disease. Whatever it is due to, when you have chronic liver disease and advanced liver disease, these are the signs and symptoms that you may experience, including yellowing of the skin, muscle wasting, confusion, fatigue, itching of the skin or pruritus, easy bruising or severe bleeding, fluid retention, which can happen in your abdomen or in your lower extremities, mainly your legs or your feet. It can increase your risk of infections. That most people complain of cold intolerance or staying cold all the time. And also it can cause decreased appetite, anorexia, and nausea. Because the liver is so important carrying out so many functions, as you can see, when the liver is damaged, many things start going awry. This is by no means a complete list of signs and symptoms, but just kind of highlights the most common ones. So now that we know this, let's focus the remainder of our time on this topic. How do you stay healthy despite having a chronic disease process, specifically chronic liver disease? The most important thing is this: stay positive. Don't let your disease define you. Your mind is your most powerful tool. It is well known that a positive attitude can be a driving force towards healing and better health. So surround yourself with positivity. Continue to strive for your passions. Find those people around you that will support you and understand you, and continue to do the things that bring you fulfillment. Second, take control of your health. This is very important. Ask pertinent questions regarding your health. Learn your medications. If something doesn't make sense, ask for explanations until you understand or are satisfied with the answers. Finally, knowledge is power, and in this case, it can really save your life. So, do a good job learning about your disease, learn about your body, learn about your options. Seek a second opinion if you feel that you need to get one, and get your family and close friends involved. It's always more helpful when you have a team of people surrounding and supporting you. Now, let's go over the tips specifically. So, first and foremost, abstain from alcohol if you have liver disease. In healthy adults, 1 drink a day for women and 2 drinks a day for men is considered safe. And here in this cartoon, I have a depiction of what different drinks are and the ounces that it qualifies an amount of alcohol. And these are all equivalent. So a 12-ounce can of beer is equivalent to 5 ounces of wine, is equivalent to about 1.5 ounces of brandy. Heavy or high-risk drinking is defined as more than 8 drinks a week for women and more than 15 drinks a week for men. Stay active. A sedentary lifestyle really increases your risk of liver disease and increases the release of pro-inflammatory or harmful cytokines, which are substances that can be released in your body. We know that exercise releases endorphins, or the good substances, and increases your energy level and quality of life. We also know that exercise is known to improve muscle mass, decrease the risk of liver inflammation, the amount of fat, and even scarring, and this can happen even without significant weight loss. We also know that exercise may decrease the risk of liver cancer. So make sure that you move. And I know with liver disease and chronic fatigue, this can be quite challenging, but the important thing is to start slow and stick with it. You can start by walking in place or doing seated leg races. Any movement is good. So ideally, we want to work ourselves up to about 30 minutes of activity about 5 days a week. That is what's recommended. If you can incorporate some strength training 2 to 3 times a week, that's even better. You want to stick to a routine that you will maintain. So that means find something that fits your schedule and your lifestyle. There is data that shows that people that are constantly moving, as opposed to sitting at a desk or only doing short bursts of exercise, tend to burn more fat. So if you have a primary desk job, try to get a standing desk or wear a pedometer. Take the stairs as much as you can, or park farther away from the entrance to where you need to go. Walk during breaks and especially after meals. So every time you move your body, it really does help. Set realistic goals and expectations. When you first try to do these things, you may want to try to sign up for a charity walk. Things like that really can get you motivated, can get other people, and you see other people involved, and those are realistic expectations that you can set for yourself. Finally, encourage your friends and family to join you if possible. Competition and challenges at work with friends often drives people. So you can do that 10,000 steps a day challenge, and you can slowly increase your goals every week or every month. And if you can't find friends or coworkers to join, there's lots of online options and groups that are available to really motivate you, and you feel like you're there with a group of people. Next, maintain a healthy weight. Of course, this is easier said than done. The most important thing is to eat balanced meals, and we'll talk about this a little bit more specifically in the next few slides. Mainly avoid sodas and sugars, and avoid fad diets. The most important thing is consistency. Don't overindulge. Don't eat just to finish. So when you feel full, just stop eating. And very importantly, eat, not drink your calories. It's amazing how many calories we ingest just with sugary drinks and sodas. We know that in patients with fatty liver disease, losing even 5 to 10% of your total body weight can significantly reverse the fat, the inflammation, and scarring or fibrosis in your liver. So this is a nice pyramid that shows what amount of weight loss can be associated with biopsy changes in your liver. So for instance, if you look at the lower pyramid, if you lose about 3% of your body weight, you can see an improvement on steatosis or fat. If you lose about 7%, you may see an improvement in many of the inflammatory markers in your liver. However, if you lose up to 10% or more, there's data that shows you can actually see regression or reversal of some of the scarring. So this is very important that balanced diet and exercise helps you decrease fat, inflammation, and scarring in your liver. So let's discuss more specifically healthy food choices. I know there are many diet options out there, but this is what I would recommend as the best diet because it has the most compelling data and results, and it's not too hard, and it allows you to eat quite a lot of things. So many of you have probably heard of the Mediterranean diet. It's primarily a plant-based diet that is rich in antioxidant fruits and vegetables. As you can see, there's a lot of color there, and that shows a lot of the antioxidant fruits and vegetables. And the part of the Mediterranean diet is you can have up to 9 servings a day of these things. And more importantly, it's not necessarily limiting your fat, but choosing healthy fats or monounsaturated fats. And one of those fats is olive oil, using olive oil in your cooking and in salad dressing. Also eating nuts, because nuts are high in fat. But you don't want to eat large amounts and really don't want to do more than a handful a day. As importantly, you really do want to avoid candied or honey roasted or heavily salted nuts. You want to really minimize simple sugars, and you want to add lean protein. So as I said, you want to minimize red meats and sweets, but you can get lean protein such as fish and seafood. You want to drink plenty of water, and you want to use herbs and spices instead of salt to flavor foods. So this type of food is what is typically eaten in the Mediterranean region. And even though they do have a lot of whole grains and breads, instead of butter or margarine, they will dip it in olive oil. So all these little modifications can really help you be more balanced and have a healthier diet. And this is actually pretty easy to do because it doesn't restrict you and you really have a lot of food options. You just have to plan ahead when it comes to your meals. Next, there is data that shows that coffee and olive oil are good not only for your heart, but also for your liver. We know that caffeine is an anti-fibrotic agent. So what that means is that it can decrease scarring and even cirrhosis. This has been shown in trials in patients with hepatitis C. It has shown to decrease fat in patients with fatty liver disease. It has shown to decrease risk of cancer in patients with chronic liver disease. And so this really pertains to black coffee, really no cream or sugar, because those obviously have added harmful effects, can have added harmful effects. So there was a big study that showed that if you drink about 4 cups of coffee per day, there was a 64% decreased risk of mortality versus people that did not drink coffee. So 2 to 4 cups of coffee is considered healthy. Similarly, as we just discussed, olive oil is healthy for you. Again, it's because it's a monounsaturated fat. And what that means, it's far less likely than other types of fat to clog your artery. So there's data that shows 2 to 4 tablespoons of olive oil not only decreases your risk of heart disease by decreasing your bad protein or bad cholesterol or LDL, but it also can decrease your risk of liver disease. So coffee, specifically black coffee, and olive oil are good for your liver and heart. So moving on to our healthy tips. Next, get vaccinated. If you have chronic liver disease or are at increased risk of contracting hepatitis, you really should discuss with your provider about getting vaccinated against hepatitis A and B. Very important and very preventative. You should also get annual flu shots as well as the pneumonia shot as recommended by your provider. Of course, the only caveat is that you do not have a bad reaction to any of these shots that you know of. Avoid risky behavior. This is obviously very important. If you use illicit intravenous drugs, you should not be sharing needles. Additionally, it is really important to seek out help. Use a condom during sex. You need to protect yourself and your partner. If you get tattoos or piercings, do it in a professional setting where equipment is clean and sterilized. Next, use medications wisely. Take prescription and non-prescription drugs as directed and only in the recommended doses. If you have questions about your medications, ask your provider. Do not mix medications and alcohol. Be aware of the amount of Tylenol in your pain medications. This is especially important for patients with liver disease. Talk to your doctor before mixing herbal supplements that you bought from the health food store with your prescription or non-prescription drugs. Many of those can have adverse effects on your prescribed medication. In fact, I would avoid herbals and supplements altogether. This is a great cartoon, but it really does tell the truth. The problems with herbals and supplements are that most are not FDA approved. What this means is that the dosages and the packaging in each box of medications is not regulated and it's not equal. That means there can be different amounts of ingredients in each bottle of something that you get. So what does that mean? That means oftentimes things that promote liver health can often lead to liver injury, liver failure, and death. This is a great website, livertalks.nih.gov, where if you are thinking of taking a supplement, you can put the name of the supplement into that website and see if there's any associated adverse liver disease or liver failure associated with that drug. In general, your liver and your body really doesn't need a lot of these herbals. And again, more often than not, they can be more harmful than good. Finally, my last two tips would be to avoid contact with other people's blood and body fluids. Hepatitis viruses can be spread by accidental needle sticks or improper cleanup of blood or body fluids, so avoid this. Do not share toothbrushes, razor blades, or nail clippers with patients with viral hepatitis. Take care with aerosol sprays. Make sure if you're using them that the room is ventilated. Wear a mask when spraying insecticides, fungicides, paint, and other toxic chemicals. I hope these tips were helpful for you. Most importantly, stay positive, stay active, and stay informed. Thank you very much for your attention.